Welcome back to Meds Made Easy. My name is Tarun Verma, and today we're going to be talking about Mirtazapine, also known as Remeron. It is used for major depressive disorder, also known as just depression. It has off-label uses for any kind of migraine issues or headaches or panic disorders. And off-label uses are essentially it's not what the medicine was intended for, but physicians have found in practice that it can be used for these other purposes. It has medicinal effects. Beyond that, it is a tetracyclic antidepressant. None of that is necessary. What you need to know is it increases norepinephrine and serotonin in your brain, essentially making you happier. That's exactly what we're trying to do with this medication. I won't go over dosing regimens because the dosing is just so scattered on how you can take it. You can take it multiple times a day, once, maybe twice a day. It just varies, so I won't go into that. You can take it with or without meals, which makes it a very easy medication to take. Its peak effect in your bloodstream is about 2 hours, so that's when you'll definitely get the full effect. And it stays in your body for about 20 plus hours, but essentially that peak effect is about in 2 hours. If you have any sort of renal or hepatic impairment, you need to make sure that you talk to your doctor, and so that we can tweak the dosages accordingly. Let's see here. It has a black box warning for suicidality. Now, we've kind of talked about this in other videos, but a lot of these antidepressants can cause an increased suicidal thoughts in you, and that is terrible. That's a terrible side effect. If that happens to you, we need to get you switched on to a different medication altogether. Let's see here. It is a pregnancy class C medication, which means you have to weigh out the risks and benefits when you are pregnant with this medication, so make sure you're having those conversations with your doctor. It is present in breast milk. However, there have been no studies to show that it impacts the infant in any sort of negative way. But regardless, you need to make sure that you're having this conversation with your doctor if you are lactating and you are on this medication. Let's see here. I think that kind of covers a lot of it. Here's a list of the side effects of this main medication. The last big thing to really talk about in terms of this medication is if you go to get off of it. You need to taper off the medication. It works in your brain, so you can't just stop cold turkey. Your body doesn't know how to function, especially, and all of this really depends on how long you've been on the medication. It depends. The shorter time you've been on this medication, the easier it is to get off of it. If you've been on it for months and maybe even years, it's definitely a lot longer of a process to get off the medication, but you essentially will put you on a system where you take less and less and less until your body gets used to not having the medication. If you do quit cold turkey, you're going to see some really, really bad side effects. Headaches being really, really bad. One of them, you can have really intense headaches or even just slow, like dull throbbing headaches that don't go away with ibuprofen or any sort of over-the-counter medication that you would take for headaches. So I think, guys, that's it. I try to make these videos as short as possible. Please leave any comments down below. Give us a subscribe. Let us know how we're doing, good or bad. We'll see you guys next time on Meds Made Easy. Thank you.